All right, so before we dive deeper into MIPS performance categories, like MIPS, Merit-Based Incentive Program, part of that larger quality payment program. And those 4 categories, again, that we'll talk about now are quality, promoting interoperability, improvement activities, and cost. And that final MIPS score is what's going to allow you to have either a positive, so an increase in fees per CPT code, a neutral or just even, or a negative payment adjustment to your Medicare reimbursements. So now these payments are, of course, tied to a performance period that typically runs January to December each year. So you should submit your data kind of Q1 of the following year. CMS will review that data and then apply that adjustments 2 years after the performance year. So for example, if you had 2023 performance is going to actually influence 2025 payments, which is kind of what I described earlier. So understanding when to collect data, when to submit it, when to expect financial outcomes is really important. Again, head over to CMS website, put in your MPI number, see if you qualify. So the first and probably the most well-known is the MIPS quality category. This is the category that makes up kind of one of your largest portions of your MIPS score, which is about 30%. And this basically assesses the quality of care that you provide by evaluating various healthcare processes, some outcomes, or even patient experiences. And you are going to report 6 quality measures that you select, including 1 outcomes measure. And you are collecting that data for that entire year, January to December, and that you're submitting data for at least 70% of your eligible patients. Again, use your EMR system for this. Like, doesn't need to be fancy. Talk to your EMR to flag basically certain quality measures. And there are measures that are relevant to both your patient population. They could be relevant to your specialty. There's a whole section on this on the CMS website. And really, you may be doing these things already, but again, it's about documentation and about submitting that data. This is a pain, but if you can get 2% higher in terms of payments, it may be worth it.